A brief motivational interview in a hospital setting for adolescents smoking a preliminary study, presented by Brian Morgan. Okay, so a little bit about the previous research. Although the overall prevalence of cigarette smoking has been declining, the rate among American youth has risen since 1992. More than 50% of adolescents attempt to quit smoking each year. Among those who smoke 10 or more cigarettes per day, fewer than 20% are successful. Healthcare settings provide an opportunity to reach adolescents who are in need of smoking interventions but are not served by other sources. Motivational interviewing combines personalized feedback regarding substance use effects with empathetic, non-confrontational therapeutic style. So the current study tests the feasibility of conducting a brief MI for teenage patients identified as smokers at the time of their hospital visit. A randomized two-group design compares smoking outcome of patients receiving an MI with those of the patients receiving brief advice, the BA group. So the participants were 40 smokers between the ages of 14 to 17. 17 of the participants were males, the remaining were 23 females. The setting, all participants were recruited while receiving treatment at an urban hospital emergency department. The baseline. During baseline, a 5-item stage of change algorithm classifies smokers at baseline and follow-up into pre-contemplation. The FTQ, a measure of nicotine dependence, was administered at baseline and follow-up. The Center for Epidemiological Studies Depression Scale was administered at baseline. The MI intervention. The interventionists used an empathetic therapeutic style, avoided argumentation and resistance, developed a sense of discrepancy between each teen's goal and behavior, and supported teen self-efficacy. Additional tactics described as effective by Miller and Syringe 1989 were applied, including giving individualized feedback and effects of the smoking on the teen, emphasizing the teen's choice and personal responsibility. So right here you can see that during the MI intervention, the authors have individualized the treatment for each individual person. After completing the baseline assessment, each BA received advice to stop smoking. So this advice consisted of a brief interaction with an interventionist during which the teen was given the same informational handout as used in the MI condition and was encouraged to stop smoking and to get assistance if necessary. This is almost similar to as giving somebody a placebo, or really not giving them a placebo, more so just not giving them the same amount of treatment as you're giving the other group. The results. The data received during the baseline was compared using a t-test and the chi-square test to determine whether there were any pre-existing differences between the two groups. The authors found no significance. Between groups, differences on smoking measures were not significant at the 3-month follow-up. So, discussion. The reason that the author stated several reasons why they may not have found a significance at the 3-month follow-up. One of the reasons was it may be that the small number of adolescents, like adults, are able to quit on their own with sufficiently enhanced motivation. So, a few limitations. This study was limited by the small sample size, a short follow-up period, and a potential bias in self-report measures. Thank you.